Morning, I am Kati Joy Lagutin Salcedo and I will be utilizing an audiovisual presentation as my teaching strategy. And my topic is all about oxygen therapy. Hi nurses, now I would like to discuss with you the different types of oxygen therapy for patients with impaired gas exchange. As we all know that oxygen can be delivered through different routes, right? I know you already have idea regarding this topic and this is just a review of what you have learned before. And this discussion includes all the need to know informations together with some nursing considerations that will be helpful in caring your assigned patients. First, we need to know the definition of oxygen and the indications of giving oxygen therapy. Oxygen is a colorless, tasteless gas essential to a living organism being taken up by animals and us people. And oxygen therapy is a treatment that provides supplemental or extra oxygen. If the blood has low levels of oxygen, it cannot deliver enough oxygen to the organs and tissues. And this can damage the heart, and as well as the brain, as well as the other vital organs in the body, which could be fatal if not treated. And for the indications of oxygen therapy, this includes the following. First, treatment of documented hypoxemia. Second, acute respiratory failure. Third, pulmonary fibrosis. Fourth, transfusion-related acute lung injury or the TRALE. Fifth, cardiac failure. Sixth, treatment for patients with decreased oxygen carrying capacity like in anemia cases and sickle cell anemia patients. Seventh, hypermetabolic state induced by trauma. Eight, shock. And nine, during CPR. Actually, there are many indications for oxygen therapy, and those mentioned earlier are most common disorder or illnesses that I have encountered. There are two categories of oxygen therapy. First is the low oxygen delivery system, which includes the nasal cannula, simple mask, partial rebreather, and non-rebreather, and the other one which is high flow oxygen delivery system, which includes high flow nasal cannula, Venturi mask, non-invasive passive pressure vent or NPPV, BiPAP, and the CPAP. So with your nasal cannula, the rate should be between 1 to 6 liter per minute. But normally, we're only using a maximum of 4 liters per minute with a humidifier to preserve the tissue integrity. For patient requiring more than 4 liters per minute, they need another alternative mode of delivery. And for patient with COPD, it is a big no-no to give more than 92% of oxygen or else the opposite way around will happen to your patient. As a nurse, we need to constantly assess and reevaluate our patients, and we need to address the changes we encounter during every assessment. Moving on to simple mask. A simple mask contains holes on the sides to let exhaled air through and to prevent suffocation in case of a blockage. The range of oxygen can range between 40 to 60% as minimum flow rate wherein 40% is equal to 5 liters per minute or 50 to 60% which is equal to 8 liters per minute. This mode is delivered temporarily when there is a rapid change in the patient's oxygenation status. Take note, as I have mentioned earlier, as a nurse, it is our duty, our obligation to assess or to reevaluate our patients for signs of respiratory distress, nasal flaring, prolonged capillary refill, which means greater than 3 seconds, or patient which reports of feeling dyspneic or shortness of breath. Next is the partial rebreather mask, which delivers 6 to 11 liters per minute, which is equivalent to 60 to 70% of FiO2. This is normally used to patients with very low levels of blood oxygen, as this mask delivers oxygen quickly to the blood. The mask covers the nose and the mouth of the patient and is inflated with a reserve bag that has no flaps so that the patient will rebreathe one-third of the tidal volume. As a nurse, Make sure that the bag is always inflated by adjusting the flow rate to meet the patient's oxygen needs. The bag might kink, deflate, and obstruct the oxygen flow. So, religious monitoring is a must, or if the patient is conscious and oriented, you can educate them regarding this matter, or you can simply inform the patient, significant others to take a look of the bag. Moving on, we have non-rebreather mask, which delivers 10 to 15 liters of oxygen per minute. This mask covers the mouth and the nose with a reservoir bag with exhalation ports that have a flap over each port to prevent room air from entering that could dilute the oxygen concentration. That's why it's important to make sure that the ports are contained within. This allows the patient to get the amount of oxygen needed for the reservoir bag. Non-rebreather mask delivers the highest oxygen from the category of oxygen delivery system. As a nursing consideration, one should understand and should be knowledgeable regarding oxygen toxicity because oxygen therapy can also cause injury to the lungs. If the oxygen is greater than 50% or higher than normal partial pressure for about 24 to 48 hours, the longer the duration, the worse the symptoms might happen and could lead to hyperoxia. It can cause oxygen toxicity or oxygen poisoning. Moving on, let's talk about higher oxygen delivery system. For higher oxygen delivery system, first we have the high flow nasal cannula, also known as Optiflow or Vapotherm. This can deliver 30 to 60 liters per minute with a combination of heat and humidity to help decrease the mucous membrane damage, and is overall better tolerated because it has prongs on its narrows and it's more comfortable for the patient. Let me give you one nursing key point to remember. The humidifier is a source of infection. It can harbor fungus and bacteria, and even those nasal cannula or masks that we are using is not exempted. They can also harbor bacteria or funguses. And it is necessary to change or be sure to change it as needed. And you should follow your hospital protocol and guidelines on changing those. But if it's already like you're already using it for longer duration, so it's better to change it. Moving on, Venturi mask. So this is a high flow oxygen device which give an exact FiO2 ranging from 24 to 40%. It has a flexible tubing oxygen line with a fixed orifice device with different colors specific to a liter flow. There are 6 different colors of these valves that delivers an exact amount of oxygen. As you can see in the image presented, those are the 6 different colors with specific flow rate. The colors may vary depending on the manufacturer, but you can refer to your RT or your respiratory therapist, which has more knowledgeable about it. The Venturi masks are used to patients who have hypoxic drive and needs a supplemental oxygen, and this would include COPD patients. Next, we have the non-invasive positive pressure vent or the NPPV. This is commonly used for patients with COPD, hypercarbia, or an increase in carbon dioxide in the bloodstream, acute asthma attack, or dyspnea. This machine uses a positive pressure that allows the alveoli to open to prevent intubation. This includes two modes, the BiPAP and the CPAP. For BiPAP, it delivers a set of inspiratory with each breath that provides a positive airway pressure. For CPAP, the goal is to expand the collapsed alveoli. This machine is commonly used to patients with OSA or sleep apnea. Both CPAP and BiPAP are commonly used for post-extubation to prevent reintubation or for the patients with COPD or atelectasis from any surgery. And this wraps up my discussion regarding the different types of oxygen therapy. Is there any questions, clarifications? Okay, hope you guys have learned something from the topic and good luck with your future duties. Thank you for listening and good morning.